Hello everyone, welcome back to my channel. I hope you all are doing good. So today I am going to discuss about essential newborn care. So first of all, we have to know what is newborn or in which period of time we are calling the baby as a newborn baby. So as per WHO, the definition of newborn is a newborn infant or neonate is a child under 28 days of age. It means after the baby born or after the baby's birth up to 28 days. This period we are calling as newborn baby. Okay, now we have to understand what is the essential care for newborn. Okay, and what is the need for this essential care. So every baby is having a right of getting their 4 basic right, that is protected from any kind of injury or infection, or to breathe normally, to be warm. Warm is very important as they are in a different environment now. Before they are in the mother's womb, but now they are in the environment, so that is also very important. And to be fed, that after baby's birth, just after birth we have to start breastfeeding. So these are the basic right of every babies. So essential newborn care involves immediate care at the time of birth as well as essential care during the entire newborn period. It doesn't mean that only after the baby's birth, that time only we will provide the care to the baby. Okay, so we have to take care of the baby continuously throughout the neonatal period. So that is the essential newborn care. So now next slide is about essential newborn care include. So what are the things are included in the essential newborn care? So first is immediate care at birth. Means what are the care we are giving at the birth. Okay, later I will discuss one by one. Next is thermal care, that is maintaining the temperature, about that. Then third is resuscitation care when needed, care of cord, then infection prevention, then assessment of health problems, then recognition and response to any kind of danger signs, and lastly is timely and safe referral when needed. So one by one I will discuss now. So first is thorough drying. So what is the need of drying? Now baby was in the amniotic fluid. So after delivery of the baby, in the baby's body there will be amniotic fluid. So the fluid can decrease the or reduces the body's temperature. So that's why we need to dry the baby. So how we will dry the baby? No, before baby's birth, before half an hour only, we will keep on the radiant warmer, and under the radiant warmer we will put the clean cloths. 2 clean cloth is needed, and that will be warmed in the radiant warmer. So when the baby is we are receiving the baby, that time only we will receive the baby in the warm cloth, then we will wipe the baby thoroughly. Okay, so by that process we will dry the baby. So how we will dry the baby? No, first we have to dry the head of the baby, then body, then arms, then legs, and then back. Okay, gently we have to wipe. Why? Because in the baby's body one greasy white substance is present, that is called vernix caseosa. Okay, so that is very thick and sticky substance, white color substance. So we should not wipe the vernix caseosa, because the vernix caseosa will maintain the body's temperature, and it also helps to maintain the moisture of the baby's body. Now next is skin to skin contact. So just after baby's birth, it is very important to start the skin to skin contact with the mother's chest. So how we will do that? No, we have to place a hat on the baby and then put the baby in between the mother's breast in upright position, and baby's face we have to turn in any one side to maintain the airway of the baby, and also baby's hip should be flexed and extended like a frog like position. Okay, and this direct skin to skin contact in between mother's chest and baby's chest will also give stimuli to the baby's chest whenever mother's chest is moving. So that will help the baby for breathing, and also it will maintain the thermal synchrony. So what is the thermal synchrony? That is no swings of the temperature. That means if the baby's temperature decreases 1 degree, then temperature of the skin of mother in contact with baby goes up to 2 degrees Celsius to warm the baby rapidly. And if the baby's temperature will increase 1 degree, then the temperature of skin of the mother will decrease 1 degree Celsius to prevent hyperthermia in the baby. Okay, so it helps in thermal synchrony and also in the providing stimuli to the baby's chest for breathing. Now coming to the assessment of breathing. This we have to start whenever we started the thorough drying. That time only we have to assess the baby is able to breathe or not. Okay. So if the baby is not able to breathe, that time only we have to go for resuscitation. In resuscitation I will discuss in a different video. Next is delayed cord clamping. That is also important. Like first 1 to 3 minutes or first few minutes of birth, if we are not clamping the cord, that time some extra blood will come from the placenta and that can prevent anemia in the baby. Next is early initiation of breastfeeding. So it is very important to help the uterus contract and reduces the maternal bleeding, and the colostrum, which is the yellowish color which comes for very few days of our early stage, that is important for antibody development in the baby's body and to protect the baby for any kind of infection, and it is nutritious, easily digestible for the baby. And exclusive breastfeeding also improves the bonding between the mother and the baby. So next is thermal care. So it is very important to maintain the baby's body temperature. So as the baby in the mother's womb was in the 38 degrees Celsius temperature. So suddenly when the baby is coming out from the womb, so in the environment that is much colder environment. So it is very easy the baby can lose the heat. So that's why we have to keep the baby warm. So we can start with KMC, that is kangaroo mother care, with skin to skin contact with mother, or else we can keep the baby in the radiant warmer. So before delivery of the baby, before half an hour of the delivery, we have to switch on the radiant warmer in the manual mode. So about radiant warmer I will discuss in a different video about the setting or the parts of the radiant warmer, but in this video only I will tell about the modes. There are two modes in the radiant warmer. One is servo mode and another one is manual mode. So what is manual mode? So whenever we are not putting the baby in the radiant warmer, that time we can keep the warmer in the manual mode for heating the cloth or heating the bed or bassinet of the radiant warmer. And second is servo mode. So whenever we are receiving the baby, that time we will put a thermistor, that is the probe, thermal probe, that we will put in the baby's body and we will put it in the servo mode. Servo mode means that the radiant warmer can identify the baby's temperature, and as per that it can adjust the heat of the warmer. Okay. So next is prevent heat loss from the baby's body. So there are 4 ways of losing the heat. First is radiation. Radiation is not covering the baby's head so that its body heat is able to pass into the surrounding air. So for that we have to put the hat on the baby's head. So next is conduction. So what is conduction? Now leaving the baby on a cold surface, particularly on the metal surface, or like whenever we are weaning the baby in wet machine, directly we will put the baby in the wet machine. That also from the surface the baby can lose the heat. So that also we have to prevent, like we have to keep the baby in the mother's with the mother, and whenever we are placing the baby we have to keep with the warm towel. So next is convection. What is convection? That is we have to, if we are placing the baby in front of moving air, that time also the baby's body temperature will go. So for that we have to keep the window or door, we have to keep that closed. Next is evaporation. Evaporation we have to prevent by drying the baby thoroughly. If the baby's body there is some fluid, that is if we are not thoroughly dry the baby, so amniotic fluid whichever present in the baby's body, that time through evaporation baby can lose the heat. So next is nurturing care. Under nurturing care, first is care of eyes. So just after delivery of the baby we have to clean the eye with using cotton swabs which is sterile, dipped in a sterile water. So for both the eyes we have to use different swabs. So we have to do it from inner canthus to outer canthus, as we know, from less contaminated to more contaminated. And if it is needed any medicated eye drops, that also we have to instill. Then is care of skin. What is care of skin? I have already discussed about vernix caseosa, that we should not rub it off, and the babies are having so many creases in the body, like neck area, axillary area, groin area. There are so many creases or folds. So there we have to pay more attention. If there is presence of any fluid, so we have to clean that also thoroughly to prevent any kind of infection or bacterial growth. So next is care of cord. So the stump is left without any dressing and it should be checked for bleeding up to 24 hours. And we have to observe routinely that there is any redness, inflammation, discharge, swelling present or not. So this is all about essential newborn care. So next video I will start with some disease conditions. So thank you so much for watching my video. If you liked my channel, please do subscribe and share it. Thank you all.